Your gut is always sending you signals, but sometimes they can be, well, pretty confusing, and let's be real, kind of alarming. So in this explainer, we're going to decode two of the most critical clues it can send your way: GI bleeding and abdominal pain. Think of this as us finally learning the language of our own digestive systems. All right, let's get into it. So, really, what is your gut trying to tell you? I promise it's not just random noise. These are actual messages about what's going on inside. And believe me, learning how to interpret them can make all the difference in the world.
And we're going to focus on these two specifically because they're just fundamental. They're the big ones. It's kind of like primary colors, right? Once you understand them, you can start to see a much, much clearer picture of what's happening with your health.
All right, first up, bleeding. And what's so cool about this is that the color and the appearance of the blood, it literally acts like a GPS. It gives you a surprisingly accurate idea of where, along that long, winding road of your GI tract, the problem might actually be.
Okay, so the first term to know is hematemesis. That's just the medical way of saying there's blood when you vomit. Now, if it's bright red, that tells you the bleed is fresh, it's active. But what if it looks like coffee grounds? That's the real clue. It means that blood has been sitting in your stomach acid for a bit, which is a huge pointer that the problem is somewhere in the upper GI tract.
Next up is something called melena. And this is a really distinct sign: dark, tarry, black stool. And that color? That's what happens when blood gets broken down by all your digestive enzymes on its long journey through your system. So just like those coffee grounds we talked about, this is another huge clue that the bleed is happening way up high.
And the last one here is hematochezia. This one's pretty straightforward. It's when you see fresh red blood. And because it's still red, well, that means it hasn't had time to get digested. So it's a dead giveaway that the source of the bleed is much, much further down the line. We're talking the lower GI tract, like in the colon or rectum.
Okay, so let's just put this all together real quick. It's actually pretty simple. If you see darker, digested blood, think coffee grounds or that tarry black stool, it's pointing to a problem up top in the upper GI tract. But if you see fresh red blood, it's pointing down low. It's a really simple but super powerful rule of thumb that pretty much guides the whole investigation from the get-go.
So, now that we've got the language of color down, let's see where it leads us. And we're going to start with the upper GI tract because, well, statistically, that's where most of the action happens.
I mean, get this, a full 75%. That's 3 out of every 4 cases of acute GI bleeding. And that one number right there is exactly why doctors almost always start looking at the upper GI tract first when they're investigating a bleed. You follow the evidence. So who are the usual suspects up there? Well, the number one culprit by a long shot is peptic ulcer disease. You know, those sores in the stomach or duodenum that are often linked to H. pylori bacteria or using a lot of NSAIDs. After that, you've got things like esophageal varices, which are basically swollen veins connected to liver issues, and Mallory-Weiss tears, which usually happen from really forceful vomiting. And what's really interesting is how the likely cause can totally change depending on your age. For adults, yeah, we're usually looking at ulcers and varices. But for kids, it's much more likely to be some kind of inflammation, like esophagitis or gastritis. And for a brand new baby, it could be something as simple as them having swallowed some of their mom's blood during delivery. All right, let's continue our journey down the GI tract. We're heading to the lower section now. Lower GI bleeds are definitely less common. They only make up about 1/4 of all cases, but they bring a whole new set of clues to the table. The biggest player down here, especially as people get older, is something called diverticular disease. These are tiny little pouches that can form in the colon wall, and they can cause this sudden, massive bleed that's often totally painless. After that, you've got ischemic colitis, which is where blood flow gets cut off, and then the more common things like hemorrhoids, IBD, and even tumors. Okay, but here's a bit of good news. Over 80% of these lower GI bleeds actually stop all by themselves. But, and I can't stress this enough, this is a huge but, any bleeding, any at all, is a sign that something is not right. It's something you should never, ever ignore. You always need to get it checked out by a professional to figure out what's really going on. Okay, so we've pretty much decoded bleeding. But a lot of the time, bleeding doesn't come alone. It brings its buddy, pain. And abdominal pain is super common, right? But what's causing it can be just as complicated to figure out. So what's really going on in there that causes that ache or that cramp or that awful sharp pain? I mean, there are a million different conditions, but the actual reason you feel pain
It almost always boils down to one of four main things.
So yeah, most gut pain comes down to one of these four triggers. First, you've got inflammation or infection. That's just your body's immune system freaking out, causing swelling and irritating all the nerves. Then there's an obstruction, which is exactly what it sounds like, a blockage that creates a ton of pressure. Third, and this one's serious, is a perforation, basically a hole that lets stuff leak out where it shouldn't be, causing major irritation. And finally, ischemia. That's when tissues don't get enough blood and they start screaming for oxygen. And that scream is pain.
Okay, now for one of the weirdest things about abdominal pain. How is it possible that a problem with your gallbladder, which is tucked away on your right side, under your ribs, could cause a sharp pain in your right shoulder? I mean, that makes zero sense, right? Well, there's a really cool neurological reason why that happens.
It's a phenomenon called referred pain. Basically, the nerves from your internal organs share pathways, like a highway, with nerves from your skin and muscles on their way to the spinal cord. And since your brain is way more used to getting signals from your skin, when a signal comes in from an organ on that shared highway, the brain gets confused. It misreads the GPS and thinks the pain is coming from a more familiar spot, like your shoulder. And for doctors, this is a massive clue. Take appendicitis, for example. The classic story is that it starts with this vague pain right around your belly button, before it moves down to the lower right side. That first ache? That's referred pain. And that right shoulder pain we just talked about? That's a textbook sign that an inflamed gallbladder is irritating the diaphragm nearby.
So now we have all these clues, right? We have the color of the blood, we have the location of the pain, even weird referred pain. So how do doctors put all these puzzle pieces together to figure out what's wrong? Well, they follow a really logical step-by-step process. It always starts with your story. The details you can give about your symptoms are the most important clues of all. From there, they'll do a physical exam looking for tenderness or other physical signs. Then they might run some lab work to check for infection or see how much blood you've lost. And if the picture still isn't clear, that's when they bring out the big guns, looking inside your body, either with imaging like a CT scan or by going in directly with a tiny camera, which is an endoscopy.
And you see, it all comes right back to where we started. This quote from a medical textbook just confirms it. The appearance tells the story. Melena, that dark, tarry stuff, strongly suggests the bleed is from the upper GI tract. Hematochezia, the fresh red blood, almost always comes from the colon. That simple rule is the bedrock of the whole investigation.
Look, these signals, the bleeding, the pain, they're not random. They're language. It's your body's way of trying to tell you that something needs your attention. So the real takeaway from all of this is pretty simple. Your body is talking. The only question is, are you listening?